Inova Fair Oaks Hospital, and I'll be your facilitator today in collaboration with our talent acquisition team. We do have two recruiters joining us today. We have Carol and Erica, and they will be actively monitoring our chat box. So should you have any questions, please feel free to utilize that chat box. We will get to your questions towards the end of the busy agenda. As you can see, the agenda is right in front of you. We have a very busy hour-and-a-half session, jam-packed. We do have time at the end for the Q&A, so that will be left there. And I know what you're all probably thinking is, do I have to be drinking a cup of tea during this virtual tea? No, I have coffee next to me. You can drink whatever you like, but we're very happy that you're here. We do understand that you have a lot of opportunities in the healthcare system, so we're very happy and just grateful that you're here joining us today here at Inova. We do hope that by the end of this session, you will consider us as an employer of choice. That's our goal from our side. And as I turn it right now to our president here at Fair Oaks, Dr. Raj, I would love it if you could follow him also on Instagram at Raj Chand MD. Raj, the floor is yours. Welcome.
Awesome, Sean. Thanks so much for allowing me to participate, and great to see you all. Welcome to one of our Fair Oaks virtual teas. We certainly would love to do this in person. I thought I'd just take a few minutes to tell you about my experiences at Inova and also at Fair Oaks. I'm an emergency physician by background. I still clinically practice in our ED a few times a month when the opportunity allows. And Fair Oaks in particular has been my professional home for the past 12 years. And it's just been such a great place to grow and learn and make friends. And so it's just really been such an important part of my life for such a long period of time. And I think as a new grad, one of the things to think about is where is a place that you can get a similar type of experience where people are really going to be invested in your learning, helping you succeed, helping you get the opportunities that you may want sort of down the road in terms of personal and professional growth. And I think those opportunities in particular abound here in our health system. And it's really for two reasons. One is we are a highly values-driven organization, and I think hopefully we'll have the chance to talk about some of that. We're clinically led, and I think that often shapes a lot of our vision around the delivery of healthcare. And just so as an example, I know that recently with our COVID surge, our ED team had mentioned that it was very difficult. They were receiving a large number of phone calls from patients because they couldn't quite understand their COVID results. It said detected, and they wasn't sure what that meant. So Debbie Fulbrook, who's our chief nursing officer, she and I took that to our IT teams. We escalated that, and we were able to get that resolved rapidly and in real time, and hopefully reduced some of those calls for our ED providers. So there's those types of things when you have clinicians leading an organization, that those types of changes can happen really fast. The other thing is in terms of personal growth, I know Kimberly Dillon's here, so Kimberly will wave at some point and certainly introduce herself. But Kimberly joined us as a new grad in 2013. She did a phenomenal job and was a charge nurse, was a unit supervisor, and then in 2017 took on the role of clinical director. She met her husband at Inova, and very recently, she delivered her first child at Inova. And so just getting to my point about how great a community this is and how great a place this is to kind of just build relationships, plant roots, and to grow this next phase of your careers. So welcome, excited to have you all with us and excited to connect with you guys. I'll drop in my LinkedIn and my Instagram in the chat, so feel free to connect with me. And then on LinkedIn, just drop me a quick note that we were on the Fair Oaks virtual tea together, and I look forward to staying in touch with you.
Awesome.
Thanks,
Thank
Sean.
you very much, Raj. We do have also our Chief Nursing Officer, Debbie. She's on the call as well, and you can see her on this slide to the right. Debbie, how are you today?
I'm doing great. How are you, Sean? And great to see everyone else. I am privileged to be with you this afternoon. And as Raj mentioned, you know, so many of our team members actually really did grow up here. Many of our nurses did grow up here, starting their careers and have been very, very successful. I did not start here as a new grad, but I've been at Fair Oaks Hospital for about 20 years in a variety of positions. In fact, Raj and I used to work in tandem in our emergency department because ER nursing is my background by training. So I've been here in a variety of positions, and I've been serving this community as chief nurse for a little bit over 5 years. In addition to that role, Inova has 11 service lines. And so I take the role of a lead nurse in that triad or threesome in musculoskeletal. So because we are a surgical hospital, and much of what we do surgically is in musculoskeletal, it's a great match for me, my passion, and what we like to see here in terms of success stories for our patients and our team members. So lots of things, and you talk about opportunity. There are lots of opportunities here at Fair Oaks, really for our new grads, but for our tenured nurses as well. You may not know, but Fair Oaks has been a magnet designated facility since 2009. And magnet designated hospitals are really an international mark of distinction for nursing excellence and outcomes. It's not all on nursing. We can say that with truth and honesty. It really is that team approach. And nursing here at Fair Oaks relies heavily on our physician partners, on our support personnel and our support team members, because honestly, we can't do it and be successful and do what we do and have each of us come to work every day with a sense of gratitude and what kind of joy do I derive from my work and my workplace every day. So it really does take a group effort, and I can say with absolute honesty too that this is a community in which you will find support, you will find growth opportunities, you will find opportunities to grow in ways that you never even thought. So lots of doors can be opened for you. Think of it too in terms of, I think Raj mentioned that we're part of a bigger organization. So, Inova has 5 hospitals total. And so you might think, well, I might start maybe on a unit at Fair Oaks, and maybe after a couple of years, I have the opportunity to grow into maybe, doing heart and vascular surgery or organ transplant surgery over at Fairfax. And we do have a lot of those opportunities in terms of an organization. Here at Fair Oaks, because we are centers of excellence for joint replacement surgery, bariatric surgery, and spine surgery, we have a lot of resources that support our nurses and our team members. We have navigators that partner with those of you at the bedside and tableside to, again, assure that we have successful outcomes and you derive joy and gratitude out of your work. So with that, I will turn it back over to you, Shant, but please know this is an awesome place. Trust me, those of us that have been here with some tenure stayed for great purpose and great value and really do derive a great sense of joy and gratification every day. So glad to be with all of you this afternoon. Please reach out if you have any other questions. And Shant, it is back to you now. Thank you.
Awesome. Thank you very much for that. So reverting back to the agenda, we have a lot of units that we're going to be hearing from today. Going down the list, we're going to hear from OR and peri-op services. We'll be hearing from leaders from women's and children's, also emergency services, the ED, ICU, critical care, progressive care unit or telemetry. Then we have medical, post-surgery and ortho, followed by flow pool, and then our DEU, educated nursing's unit. And then I'll share some more information regarding what may interest you regarding tuition reimbursement and forgiveness, because I know this pertains to many of you. And then again, like I said before, we'll finalize with the Q&A session. So another reminder, we have Carol and we have Erica monitoring the chat box. Anything that comes to your mind throughout this, please feel free to chat and we'll get to you. And without further ado, we will go to peri-op. So this is going to be facilitated by Chad and Brenda.
And hi, Sean. My name is Stephanie Jones. I'm actually going to start the presentation for Periop. I'm the Senior Director for Periop and can't agree more with what Raj and Debbie said. Fair Oaks is a fabulous place to work, and we are primarily a surgical hospital and work with all of our other departments very closely. Periop service is a very large service at Fair Oaks, and we have many specialties within that service. We have our pre-surgical nursing that does interviews prior to the surgical experience, our pre-op nurses who check patients in the morning of surgery, our OR nurses who are actually in the procedures, which Brenda and Chad are going to tell you a little bit more about. Then we have our recovery room nurses or our PACU nurses that recover those patients. We also have a very robust GE department that does all of our EGDs, colonoscopies, bronchoscopies, any other GI procedures here at Fair Oaks. We work very closely with our SPD, our sterile processing department, which is not directly nursing, but again, one of our partners that we work closely with. So a very robust peri-op service that has over 300 employees in it, and just a very robust department that works very closely together. So I'm going to hand it over to Brenda, who is our educator for the OR, and she's going to tell you a little bit more about our OR fellowship and mentorship that we have specifically for the OR for new grads. Brenda?
Hi, thank you. So I just wanted to say I started with Inova in 2000, and I've been here ever since. I've been at Fair Oaks since 2017, and I love working here. The OR, as a new graduate, there's a lot of choices you guys have. The OR is one of them. We offer a really great operating room fellowship. It is 6 months long, and it's a combination of didactic and on the job. So you will go to Fairfax Hospital where the fellowship is run. They have an Aztec lab there, which is fantastic. It's a simulation lab. And there's a director of that program, so she works with you. And then you learn that stuff, the didactic portion of it. You'll come here to the OR and put to work what you've learned at the fellowship. Like I said, it's 6 months. It takes probably about a year or so before you're completely comfortable. We have lots of support here. We have service line leaders, clinical mentor who's behind me, typing away, and myself, and we support all the new grads, as well as we have, master preceptors and things like that. So it's 6 months long, and then you'll be ready to work in the OR. It's your AORN. We have 14 ORs here, so it's a very, like Stephanie said, it's a very busy OR. We have 14 ORs. We do everything basically, except we do not do any neuro, and we do not do any cardiac. We do a lot of bariatrics, a lot of general surgery, plastics. We do a lot of ortho and spine. We do a lot of eyes. We do dental. Basically everything except cardiac surgery and neuro. We do anywhere from 40 to 60, 65 cases a day. So it's a very busy OR. Thank you.
All righty. Peri-op team, OR team, thank you very much. We will now change over to women's and children's, which consists of the NICU, labor and delivery, family-centered care, and this section will be brought to us by Joanna.
Hi everyone, my name is Joanna Van Sant. I'm the clinical mentor for women's and children's. Just so you have an understanding that role, clinical mentor, I do all the onboarding for all of our units. So like I said, L&D, postpartum, NICU, and lactation. I actually started on our L&D unit as a new grad in 2007. And I loved it. And the only reason why I left for a little while is I was part of a military family. So I kind of had to travel for a little bit with that. I was very happy to get back to Fair Oaks once we got back to Northern Virginia, because honestly, after being in other hospitals, nothing really is compared to Fair Oaks. It's a wonderful place to work. As far as our units up there, our patient satisfaction scores are usually, almost always consistently high, definitely for the past 3 years. We've got shared governance. And this past year was a very busy year for us. We had a total of 3,668 deliveries for this year. So it's been very busy on our units. Our labor and delivery, we have 13 private labor and delivery rooms. We have an 8-bed triage, pre-op, PACU area. We also have 3 operating rooms that are on the unit. We see anything from high-risk patients to laboring patients with various conditions. We strive to follow A1 guidelines. Our postpartum unit is a 35-bed unit. And we have lactation who goes on the postpartum unit as well as labor and delivery to assist with that. We have a level 3 NICU and sorry, forgot what I was going to say. And the NICU is a 19-bed private NICU. So it's great for families because they kind of have their own privacy with their family members there. We do have a great fellowship for our OB. The orientation for labor and delivery new grad nurses is about 16 weeks, and for postpartum is about 12 weeks. And throughout that orientation, you have classes for the fellowship that you do. They're in a variety of locations. For our OR nurses, they get trained to care for laboring patients. They get trained in the OR to circulate on C-sections. And both postpartum and labor also get some time with the lactation consultants as well. I think that is it.
Terrific. Thank you very much for that. We'll move on now to our emergency services, also known as the ER, Emergency Department, ED for short. This team is led by our very own Kimberly Dillon, whom Debbie spoke about before. Kimberly, I will turn it over to you.
Thanks, Shant. My name is Kimberly Dillon. I'm the clinical director for the emergency department. As Raj mentioned before, I started here in 2013 as a new grad nurse. So I have firsthand experience that I can share with you about what it's like to be a new grad in the ER. So a little bit about our ER. We are 36 beds. We get about 48,000 visits per year. And we really see anything and everything that comes through our doors. Our most common emergencies are cardiac, respiratory, or abdominal issues. And our nurses also participate and assist with advanced procedures, things like intubations, cardioversions, sedations, etc. So it's a really great place to gain experience in those critical care scenarios. We're also a stroke center. So we do keep our ischemic strokes and now some small bleeds in-house. And recently we implemented the use of teleneurology consults to see all of our stroke patients very early on, so they get that specialty expedited care. We're also combined adult and pediatrics ED, so you really get the best of both worlds. All of our nurses are certified both in ACLS and PALS to be able to provide care to any patient that we see. One thing to note about our ER is that we are not a trauma center. So that is one thing that I always like to point out, just in case that's something really specific that you're interested in. But we do occasionally get trauma cases that do come through our door. It's just not something that we specialize in at Fair Oaks. It's great to work here as a new grad. One, because we're large enough that our newer nurses really get a lot of great experience and exposure to a wide variety of different emergencies that they're seeking, but also not so large that it's really overwhelming. There's never really a day where you don't know your neighbor nurse working next to you. Everyone really knows each other. There's really strong teamwork in our ED. We also work with Virginia Emergency Medical Associates. They're our physician partners, and they're very much a part of our team. One unique factor about working in the emergency department is that your providers are right there with you 24/7. So it's really great. You don't have to wake up a doctor in the middle of the night to let them know what you're observing with your patient. We're all on a first name basis. So it's really great to be able to work with some awesome physicians. They do educational talks with us. We have a team meeting tonight, and our medical director will be calling in to review a case study. So that's really great that we are able to facilitate that dialogue and discuss complex cases with them. The majority of our nurses are also preceptors. I would say About 90% of them have precepted a new grad nurse at one point or another. So we're all very new grad friendly, very supportive, want to make sure that all of our orientees are successful. We really focus on professional development here. Each of our leaders meet with our nurses at least quarterly to talk about your long-term goals and develop some short-term stepping stones to get you where you want to be. It's also quite okay if you don't know really what you want to do long-term. We will help you figure that out. We've got pretty much a shared governance council or a committee for anything that you could possibly be interested in. Some of our most popular ones are our education committee, patient experience. We do have a sunshine committee, which is all about really maintaining our culture here and our team morale. We also have a scheduling council, which I like to highlight. That is probably questions are probably the number one thing people ask about when I do interviews. So they really work to help balance our schedule, make sure that we have safe staffing, while also making sure that our team members have a good work-life balance and a schedule that's desirable to them. They recently were able to trial a new holiday model. So last year, we dropped our holiday requirement from 3 holidays to 2. So each of our nurses are required to work 1 summer and 1 winter holiday, which has been a real crowd pleaser. Nikki's shaking her head because she has been working in the ER with us. And so we are happy to say that we're going to continue that for 2022. That trial went well, but that was really a result of that council and the work that they did. And we are looking for 3 new grads for this spring, as well as a couple experienced nurses. So if you have any further questions, my email's up on the screen, but don't hesitate to reach out to me if you're interested or want to learn more about our ER. Thank you.
Kimberly, thank you very much for that. That was very well detailed. A lot of good information there. As we transition next, we have our ICU unit, also critical care. We have Katie Heil on the call. She is our senior nursing director. She oversees the PCU, the ED, medical, and also the ICU. So Kimberly, Katie, I will hand it over to you.
Thank you, Sean. Hello, everybody. We're so excited to see you all on the call. Take away half of our team here, like maybe 40 of you here. We're so excited. Our acute care leaders just came from our recruitment call today with our recruiters, and we told them to be ready, that we're hoping to fill all of our positions with all the excellent candidates that are calling in today. Evelyn is our clinical director for our ICU here at Fair Oaks Hospital. She's actually getting her ACLS recertified today, so she was sad she couldn't meet you guys virtually. So I'll tell you a little bit about our intensive care unit. It's a great place to start. It is a 12-bed medical surgical ICU. And the nice thing about this ICU is, unlike others that are only specialized in neuro or cardiovascular, you kind of see a wide variety of critical care patients. So you're going to see some medical patients there, anywhere from GI bleeds to patients like Kimberly spoke to that now have a stroke, and we're giving them a medication to hopefully break up that clot, to a surgical patient that just had a vascular procedure that needs more intense monitoring. You also see patients that have deterioration that come from the floors, people that are septic and now that need to be monitored more closely in the ICU. So this unit is really special. They recently were recognized by the Association of Critical Care Nursing for their excellence in clinical practice, which is a really prestigious award for an ICU to be able to achieve. It's their Beacon Award. And it doesn't just speak to quality patient care that they provide there, it speaks to the practice environment on the unit. So you can't receive this recognition without the nurses being satisfied in their environment that they work and having support from their physician partners and their ancillary partners. This unit works very, very closely with the intensivists very similar to the emergency department. They do have 24/7 support from a doctor. So they have an intensivist that's on day shift, and then they have an advanced practice provider that's on night shift. Something quite unique in this unit is at the beginning of the shift, they do interdisciplinary rounds, and multiple disciplines come to the unit, including respiratory therapy, our nutritionist colleagues, physicians, nursing, our pharmacist, and case management. And they essentially review every patient and plan of care. So there's a nice learning opportunity for a new graduate nurse with that. What does orientation into the ICU look like? So the orientation is a 16-week orientation, and it is part didactic, so some classroom training, and then 16 weeks on the floor partnered with a preceptor. You also get a really great opportunity to work independently and study, and you get something called Essentials of Critical Care Orientation, or ECHO. You may hear that, which is really well recognized across all hospitals throughout the country. But that is a very intensive 64-hour plus independent learning that you would do independently outside. And then you have a clinical mentor for our service line, Nikki, that Kimberly referred to earlier, is a clinical mentor that works with us. So the clinical mentor would be connecting with you on a weekly basis, connecting with your preceptor, and then Evelyn, your clinical director, would also be connecting with you. Similar to the emergency department, a very established shared governance here. And I really love Inova's philosophy on shared governance. It's not just the clinical leadership making the decisions, it's the nurses making the decisions. They actually run our team meetings, our monthly team meetings. The UBC chair runs that, a nurse that's frontline. And then our clinical directors get a 15-minute spotlight there. So our nurses are quite engaged. There's a good skill mix in our ICU. We have some very tenured team members that have been nurses for 30+ years. So they're great mentors for you to have. And then we have nurses that worked in other specialty areas, maybe a progressive care, and then are transferring in. And then we do take new graduates each year. We try to put them in cohorts, so you have a partner to be with you, learn and grow with you, become your best friend at work. So what we're looking to hire for our May, starting in July, would be 2 new graduates. And I'm definitely available for any questions. You can reach out to me through here, and then I'll also put my email in the link or in the chat, and feel free to reach out to me if you have any questions. Thank you, Sean.
Katie, thank you. As you guys can see, right smack in the middle, there's a nice picture of us playing kickball. A lot of fun events that your team does. Sean and I, my colleague, we're always very happy to join, but there's a lot of teamwork that goes on in this unit and other units as well. Moving on, we will go to our progressive care unit, and the director for this unit is Christina.
Hi, everyone. Good afternoon. I'm Christina. I'm the director of progressive care. A little bit about our unit. We're a 36-bed step-down / progressive care unit, telemetry unit. We specialize in all kinds of patients, and that's why this is a great unit for any kind of new grad to start on. You'll get to see anything from sepsis, respiratory failure, GI bleeds, stroke, heart failure, pneumonia. This is really a great unit for any kind of new grad to start on. And Nikki's going to jump in and talk a little bit about the awesome new grad program that we have specifically for our unit.
Hey everyone, I'm Nikki. I know I had waved earlier when Kimberly was talking about me. Super excited about our new grad program because I actually started here as a new grad about 4 years ago in our emergency department, and I'm now the clinical mentor for PCU. Our new grad program, we are hiring 30 new grads this upcoming year. And the goal of this new grad program is to kind of get you guys all the skills that you require to progress in your career and to really get you where you want to be. So I'm very grateful that my entire job is to help support new grads and get you guys to your career goals and your career dreams. And this is a really great unit for new grads to start on because it's a catch-all unit. You see anything and everything like Christina was saying. And we also have, it's a pretty high acuity unit since Fair Oaks does not have a designated step down unit. We kind of act as a little bit of anything and everything. And we work very closely with the ICU with our critical patients. Other than that, something I'm really proud of about the PCU at Fair Oaks is that all of our supervisors also started here as new grads. So there's lots of opportunity for growth. And I'm not sure if someone said this yet, but Katie, our senior nursing director, who you heard talk about the ICU, also started here as a new grad. And that's something I'm really proud of because that just shows us that there's lots of opportunity for growth and that people genuinely want to stay here and make our hospital better. I think that's all I have for you. I will also drop my email down in the comments section, and you guys are free to email me with any questions you have. Also about the unit, we're a 36-bed unit. We're kind of divided into 2 areas. And we have lots of resources that is not typical of a small hospital. We have a clinical mentor just designated for PCU. So for new grads, what that means is pretty close monitoring and support, which includes weekly check-ins with the director and myself. So please let me know if you guys have any questions. We're all here to watch you guys succeed, and we're all here to set you up for success. So
Thank you for that, Nikki and Christina. I appreciate that. Yeah, the PCU unit does a very good job attracting new grads and does a great job developing their technical skills, but I've noticed also their interpersonal skills, which is very important in such a setting like a hospital. So I do appreciate that. We will move on to our medical unit, which is brought to us by Elizabeth. Hi, Elizabeth.
Hello. Hi. I'm so glad you guys are all here today. Thanks for taking the time to hang out with us. I'm Elizabeth Labish. I'm the clinical director on the medical unit here at Fair Oaks Hospital. And I absolutely love taking the opportunity to tell you how awesome our team is and how awesome this hospital is. I never let an opportunity like this escape me. So please ask me any questions you have in the chat. To give you an overview, we are a 36-bed general medicine unit. And our population, we also see hospice and oncology patients, which hospice patients are just a really incredibly unique experience as a nurse. It is something that we prepare you for, so it's not something that you just jump to day one on your own. But I like to take the opportunity to talk about it because it's not a population that people always picture themselves working with. And certainly it's not the majority of our population, but it does make us special. On the unit at any time, we probably would have between 1 and 3 hospice patients. But the opportunity to work with them is a life-changing opportunity for the patient and oftentimes for our team. It's an opportunity to really be there for someone in their most vulnerable moments in their life, as well as their family. So that's just a huge honor. And if that's the kind of thing that moves you, we have that on the medical unit for sure. You will encounter those patients in other areas too, but it's kind of our jam. Our gen med population is super interesting as well. It will help you build a great foundation, especially as a new nurse. I love this population. I'm such a champion of the med surg population. And I think that what my most experienced nurses say, and I've worked in a couple different settings, and they all say the same thing. They're like, if you can work here, you can work anywhere. You get your time management. You learn a lot about basically every system that can impact the body. From here, our nurses go all over. We have nurses that retire from this unit. And we have nurses that have been here a very long time that will add to your learning experience. We also have nurses that go to NP school after this, FNP, ACNP. We have nurses that go to the ICU or the PCU. So it's really good opportunity to just kind of experience the heart of nursing, as Florence intended it. And I always say about this population too, that it's I think it's a great opportunity to really maximize the nursing skills that you've learned, like therapeutic communication, assessment, reassessment, and really move the patient through a continuum with those nursing skills you worked so hard to get. Of course, that opportunity is available everywhere, but I feel like it's a key driver in our population. It's not a machine, it's not a drip, it's not a med, it's you, it's the nurse, you're doing it. So I just like to make that plug because med-surg doesn't get enough love. So that's the Gen Med population. My team is amazing. I love this team. I ask them, I think throughout Fair Oaks, you're going to find beyond benchmark teamwork. It's an amazing hospital. It really is. What makes our team unique? We did an activity lately. I asked everybody to give me a couple words. What do you think makes our team special? What are our strengths? And of course, helpfulness was there. We have each other's back, but there were a couple unique threads that I don't think you see in every team. Those were compassion, forgiveness, and humor. And multiple people said this. And I think when you work in an environment that is nursing today, you need all three of those things. And we have them in abundance. Additionally, when people come interview, I like to have them talk to the team when it's possible. And I always say, what's the best thing about working here and what's the hardest thing about working here? Because it's important to know both. No workplace is perfect, but we get a lot right. They will tell you hands down, it's the team. People respect each other. They work together. It's like a family. That's the best thing. The hardest thing, of course, and you're going to find this everywhere, our patients. We are a little bit of what I'd call like a safety net. We catch people sometimes that fall through the cracks in other places or may have difficult placement. They don't know where they are. They don't know what they're doing here. They can be confused. You will see those in every care setting though, I will tell you. But that's something that my team likes to make sure that people know. So I wanted to share that with all of you. And then I also wanted to just let you know that I do still have, if you are, I don't know who all we have on the call, but if you have been a December grad or you have that NCLEX in hand, we do still have a couple spots open in our DEU cohort, which I'm going to talk to you about DEU at the end here. I have another slide. I get to talk twice. So we'll talk more about that, but we have some spots open in our March position if you're still looking. And then of course we have 4 spots open for our spring grads too. So would love to answer any questions. Thank you guys again for joining us.
Elizabeth, thank you so much. Yes, Elizabeth is great. She's so great. We have her twice on this agenda. So she'll be coming up later in this session. But we do have, like Elizabeth said, many career opportunities at the moment. You don't necessarily have to wait. So continue to monitor our careers webpage. I'm going to drop the link later on. But before we get to that information, I want to turn it over to Jen from our post-surgical and orthopedic unit. Hi, Jen.
Hi. Hey, everybody. Great to be here with you today. I'm just going to first start off and echo that Inova Fair Oaks is an amazing hospital. We are a little bit smaller and you will know everybody. You will see faces constantly from all the other units that you will recognize. I joined here last April, so coming up on a year, and it is just become a very special place where I feel very much part of a community. And I think that everybody that joins here kind of has that same type of a sentiment. And it's very important, to know that it is a magnet hospital. So nurses are so valued here and you're listened to across all the different units. And there's so much growth potential and opportunity, and they really work on building you up. So that's just something to keep in mind across any area that you go to within Fair Oaks. The post-surgical and orthopedic unit, my name's Jen and I'm the clinical director of that unit, and we're a 42-bed unit. We have telemetry capabilities, and we also do Massimo's the company, but it's pulse oximetry capabilities. Basically, we watch our pulse ox for all of our patients for their duration after they've had surgery. So cases that you're going to see here, we're a little bit different than the rest of the units. So we are a bit more of an ambulatory unit, right? So you're going in for surgery and you're not expecting to spend a long time at the hospital afterwards. So our typical stay for patients is 1 to 2 nights. You're going to see a wide range of surgical procedures. Primarily, we have a lot of bariatric cases, joint replacements, spine cases, colorectal in general. Those are our main patient load that we have. But you're also going to see some urology, you'll see some plastics, some vascular. So you get a lot of a wide range of education. Something else to point out is that we are a center of excellence in joints, spine, and bariatrics. And so what does this mean? So this is a designation that's given from the Joint Commission, and it essentially is saying that we are recognized for having a higher level of expertise, a higher level of care for our patient population. So when you are on this unit, you're going to learn how to be the top notch in terms of care of these patients. And I think it sets up a nice foundation for you in your growth throughout your career in nursing. I am partial because I started on not this surgical unit, but I did start on a surgical unit. So it is very close to my heart. In terms of things that we focus on, so there's a lot of pain control. Right? You're coming out of surgery, you're in pain. So we're working on pain control. We're trying to make sure that there's, you're not nauseous, that you're able to get up safely so that you know that when you go home, you know what you're going to be expected to do at home and you feel safe and comfortable. We work very closely with our physical therapy and occupational therapy department. So they're always up here. We're always ambulating our patients. There's a lot of education about going home. So, with that, you're the teachers. So you're going to have a really good knowledge of all of that information. So things that people that are on here, our nurses, our techs, I'm hoping that with these pictures, you can get that feeling of we're a very happy and positive and upbeat, very team-oriented group. One of the things that I often will hear with our new grads, because we'll do weekly check-ins with our clinical mentors. That's pretty standard across all of the different units. But one of the things I hear, we'll say, okay, so what's going well? What's great about your orientation so far? And always people will say how much people are there to help, to answer questions, to jump in and teach you along the way. Our preceptors, we have very experienced preceptors that really help support you and make sure that you're going to be successful when you're on your own. And so that's something nice to hear. And then even experienced nurses that come here. We recently had someone featured on our Instagram page, and her quote was that she feels safe in her practice when she's here. And that's huge. And I think that is something important across, and I would vouch for all the units. That's something important across all the units, is how safe the nursing care is here and how much that is stressed. So, you hear a lot of things about nurses getting stretched, right? But at Fair Oaks, we really do have that support in place for you. One of a nice perk that I like to put a pitch in, and her picture is here on our slide. She's in the purple scrubs, standing in the green outlined picture. She's our night nurse practitioner, and that was a huge hit with our team because we are ones that will wake up the doctors at night, and so we do a lot of education and figuring out troubleshooting, like when do we have to call, when don't we have to call, what do we have to do? And she was a huge game changer for us. So she's here 4 nights of the week, and she's kind of our point person for, if something's going and needs escalation, she's our point person to go to. Let's see, I am currently looking for 2 new graduate nurses, spring, summer session, and then 2 that would start probably in the fall. So if you are interested, like I said, it's a great place to start. It's a great place to advance. There's a lot of certifications that you can sit for once you've been working on the unit for a while, and we would love to have you. So thank you. And I'll put my contact information in the chat as well.
Jen, thanks so much for that. When I got your slide, I was like, wow, they're having too much fun on the floor, because there's a lot of good stuff going on here in these pictures, so which is awesome. Next, we have float pool. This is going to be brought to us by Fernando. Fernando carries lots of belts, lots of responsibilities. He may or may not be on the call. Fernando, are you there?
I'm here, Sean. Thank you.
Awesome. Fernando, over to you.
All right, thanks, Sean. Thanks everybody for being here. It's a large group, and I'm not sure how many of you are experienced nurses. I think the majority of you are new grads, but wanted to tell you a little bit about the float pool because it may be something you're interested in future years. The float pools, if you don't know, are a group of nurses in my unit. It's 40 nurses and 23 techs who are trained to go to multiple areas within the hospital. They're assigned that day. They're kind of what I like to call the special operations of nurses. They go to the unit that has the shortages or the unit that has the most difficult patient care issues. We have critical care flow pool nurses. We have med tele-surge, or PCU tele-surge, COVID or flow pool nurses, and we have women's and children's. So those are the three areas you would float if you became a flow pool nurse. Qualifications to be a float pool nurse is 2 years of experience. So we like to take the best of the best when we pull people into the float pool. So we do recruit quite a bit from the PCU medical and surgical units. Almost every nurse, probably 70% of the nurses I have in the float pool came from the floors here. So it's a great place to go. The nurses are very, very tight, very, very close. They receive premium pay for floating to these different units and having that kind of flexibility on a day-to-day basis. We're unique in some ways to other flow pools in that we have our own unit. We have what's called the clinical decision unit. Has been our designated COVID unit over the past 2 years. And the pictures you can see here are taken on the COVID unit. And all of our nurses, our med tele nurses, interestingly, on that unit are trained to IMC levels of care on certain patients. And in that unit, we can have ICU, IMC, and regular med tele type patients that are COVID. One of the unique things about Fair Oaks, a few people have touched on it, is the leadership and the engagement and the caring that you're going to see here. You're not going to see that. I've worked in a lot of hospitals. I came here 18 years ago as a traveler. I actually worked for our chief nurse when she was back in the ER in the old days. And they lured me off the travel road and all that money because it was such a great place to work. And they were paying me a lot of money, but I loved it here that much. I've been here ever since, and I will tell you this: our float pool nurses, most of our float pool nurses, the average time at Fair Oaks is probably 8 years. So people stay; they don't bounce around. So it's a great place to be. Fair Oaks in general, and the float pool even better if you're looking at something beyond the regular floor units in a couple of years. Thanks, Sean.
Fernando, thanks so much for that. I'm going to drop 2 Instagram handles in the chat. When you get a second, sometime after this, please follow us at Inova Health and at Inova Careers. I'm going to turn over now back to Elizabeth, where she's going to talk about our dedicated education unit, the DEU. And I'm curious about what she has to say because I need to learn more about this area because I feel like, Elizabeth, they do a lot over there.
Sure, yes, happy to share. So the DEU is just another example of a way that Fair Oaks goes above and beyond to support our new grads. This is not something that is required. This is an extra benefit to help with that transition to practice. It's an evidence-based best practice for helping to ensure our new grads are set up for success. And that's why we support it here. The dedicated education unit is not like really a place. It is held on the medical unit, but what you get when you go through the dedicated education unit that you wouldn't otherwise is a specially trained preceptor who is skilled at working specifically with new grads and has additional training for new grads. You also have a more protected assignment. So we're very thoughtful and mindful about the patients that are assigned to you and also the number of patients. So we try to set you up the very best we can so you have a good learning experience. And I think it's a good opportunity to have that preceptor who has some additional training that's dedicated to your success. And from the medical unit perspective, we love our DEU participants because they come back to us, like say somebody comes through the DEU and then goes to ICU, but responds like to a rapid response one day after a couple of years, and they've been charged and they've done this and they've done that. It's a nice like connection. The other day we had a surgical nurse float back to us who had gone through our DEU, and we were like, oh, you're back, we've missed you. So it just really helps to strengthen those cross-department relationships as well, which we like about it. So I will answer any questions. I know it's kind of a unique concept, and it's not like I said, a physical unit, but it is just an additional commitment to the level of preparation and success that you can have if you're a new grad here. And I don't think if anybody mentioned these, I'm sorry, but I did just want to give you guys a couple more resources to look at. You're in the job market, you should know how we stack up against the competition, and it's really good. So if you are familiar with US News and World Report, we are top ranked. And it's things like this that make the difference. We really do set you up for success so that you can serve our patients to a higher standard than you're going to see at other hospitals. So check that out. We're top 5% in US News and World Report for hospitals across the nation. And it's our nurses that put us there, I would say. And then also our leapfrog scores are out of this world. That's safety and quality metrics that you should really look at for these other hospitals. Like any hospital you're considering working at, I recommend you look at that. We rank very well there, A+. And of course, we mentioned Magnet, which I think Jen said it. It's important to work for a Magnet hospital. I think I will always work for a Magnet hospital because it does put you as the nurse in the driver's seat to decision-making, to change, to get your patients what they need. And it tells you if an organization is Magnet, that they are committed to helping their nurses succeed to give the very best care possible. So just a pitch for that.
Elizabeth, thanks again. And thank you to all our leaders. I know you're very busy throughout the hospital, so we do appreciate you taking your time out of your day to join us during this virtual tea. But please don't go anywhere just yet, because we're going to need you to hang by and take part in our Q&A session at the end. Before we get into Q&A, I have some cool information regarding our total rewards offerings, i.e. benefits and loan tuition reimbursement assistance. So it's one thing to remember. I know a lot of times when one is looking for their new job, they go right to the salary, right to the hourly wage, but it's important to know of all aspects of total rewards, your 401k, your benefits, and even loan assistance. So one thing that we're rolling out here in 2022 is student loan forgiveness, not to be confused with assistance. Assistance comes after, forgiveness comes afterwards. So you already went to school, you got your degree, you have some debt. This forgiveness will help you with that. So for our newer employees, we're going to give you $150 a month. And those based off 10-year more senior employees, we're actually still going to give them $250. The only criteria is you have to be at least a 0.5. So you have to be working at least 20 hours a week. And you have to have at least 90 days service with us. So as long as you're meeting those criteria, we will give you that benefit. But also, in case you want to continue your education, which we always hope you do further your education, Inova will give you $5,250 a year for your tuition assistance if you want to continue your education. And this is all handled through EdCore. They handle all of our tuition assistance projects. They're a great resource. HR can help you navigate this area as well, should you have any questions or concerns. Awesome. All right. So I did put in the Instagram handle. Please follow us. I'm also going to throw in information regarding our LinkedIn page. You can follow us at Inova Health System. We also have Fair Oaks as well. I am going to switch it over now to our Q&A. I did see a lot of questions come through, so I hope Carol's on the call because we want to facilitate these and make sure we get them all answered. In case we don't get them all answered, we do have email addresses here, Carol and Erica. If something comes to mind after this call, you can always send us an email and we'll be happy to help send you whichever requisition you're interested in applying. We're very eager to help you land your career here at Fair Oaks. So with that being said, if you want, you feel free to come off mute and ask our leaders, engage our leaders directly. The floor is yours.
Hi, this is Joanna. I actually I was getting a lot of questions, so I figured I'd just answer all at once. Regarding PEDS and NICU. So we no longer have PEDS at Fair Oaks, so we clearly don't have a PICU. NICU, we obviously still have NICU, but we don't have any new grad positions for the NICU. We do take new grads, but we haven't had a new grad in about 3 years. And the honest answer for that is because our NICU staff never leaves. They've been here for a long time. Our positions have been filled for a while. So it's very rare that we have a position open in the NICU. However, if you are interested, I would definitely check out Fairfax. They have a fellowship program there. which is the same fellowship program we have if we had a NICU new grad position, but it's about 16 weeks. The next one starts, I believe, in March. So for any NICU new grad positions, I would definitely take a look over at Fairfax for those. Definitely not anti-new grads. We just, like I said, our nurses, I was gone for 9 years and I came back and almost all of them are still there. So they don't leave, but hopefully that answers your questions.
Awesome, thanks for that. Yeah, let's say you join our team here at Fair Oaks, you get into a position, you like it for a couple years, but you learn more about another position within the hospital. We have team members transferring all the time. So there's just so many opportunities here. Excellent. What else do we have? Any other questions that we can answer for you now?
I had a question for Miss Van Sant and L&D. You mentioned that some people are trained as OR circulators. Are L&D floor nurses as well are cross-trained in both, or is there circulator who does OR C-sections and they're L&D nurses? Or if I was able to get to that floor, would I get cross-trained in both? Because that is something I've been very, very interested in.
Yeah, so our L&D nurses are all trained to circulate for C-sections. So we don't have anybody off of the unit. So for our L&D nurses, for new grads, they learn L&D and they learn the OR and they circulate all of our cases.
Okay, thank you.
Hello, I'm gonna go ahead and go off mute. Oh, I'm sorry. Did someone else want to go first?
I can go after you.
Okay. I just want to introduce myself. Hi, my name is Alicia Suchisidal. I'm currently a student at George Mason, and I wanted to thank all the presenters today for giving their time and their insights. So thank you all. That was really informative. I can tell that there's a really great culture at Inova Fair Oaks. So just really looking forward to applying. My question is, how is COVID kind of managed? I know that you mentioned that there is a specific unit. Sorry, my dog is getting curious. There's a specific unit that flow pool seems to be running that is kind of holding COVID in there, but is it all over the hospital? And if so, how are you all managing that? I also work at Inova Loudon, so I kind of have a little bit of familiarity, but I was curious as to how Fair Oaks is handling it. So thank you.
Fernando, you want to get that or you want me to get it?
Yeah, I can start with this and then maybe, I was
Go,
saying
Debbie.
maybe, I'm sorry.
You go.
I can start with this, Alicia. Thank you for asking. You know, when COVID first came to us, we found ourselves in the position where we really needed to expand our critical care capabilities and capacity. The clinical decision unit, although it's a bit of a misnomer right now because it's really not a decision unit, it's kind of a remnant name and we're working on changing that name. But at any rate, the CDU has always had oversight from Fernando, whom you heard from today. And he was able, because of the float pool nurses that staff that unit, we were able to take that group of nurses and uptrain them, upskill them to take care of COVID-specific patients. Fernando mentioned, we've expanded our capacity and our competencies for our nurses to take care of some IMC or intermediate care type patients with some special training. So during the height of COVID, that 10-bed unit became a dedicated COVID unit. And the CDU staff, the float pool exclusively took care of those patients. Now we're seeing things a little bit different in terms of a variant that's not as virulent. And so we do have COVID positive patients in different areas of the hospital, like medicine, for example, on medical. We don't put any patients that are COVID positive on our surgical unit because we really want to keep that as, you know, clean of a post-op area as possible. What's interesting though is that, you know, we used to do requisite screening for our women coming in to deliver. We don't do that anymore, but we do find that, you know, we have moms that come in to deliver that are COVID positive and have been completely asymptomatic. Had a couple of COVID positive babies, in fact, in our NICU. So we're not as, you know, closed in terms of the dedicated space for COVID positive patients, but that's historically how we have managed. And COVID has become a very familiar and everyday kind of scenario for our team members and our providers and support team members to manage. So we've done lots of things, Alicia and team, to really support our nurses in terms of outreach, in terms of support for not just our team members, but our providers as well. We know that COVID has really taken, our team members to new stretches, new areas where we never thought we would be. So we're cognizant of the fatigue, and we do everything that we can in terms of rounding, providing meals, any kind of EAP support that we can for our team members and providers. Raj or Fernando, do you want to take it from there?
I think it's a great overview. Nothing else to add. Thanks, Debbie.
I do want to just add one thing to that, Alicia. I want to recognize our CNOs, and this is how connected that they are to the front line, that this is our third surge with COVID now, and we've learned a tremendous amount. And I think every single surge we understand and can care for patients a little bit better, and some things get expedited during COVID, so we're fortunate for that. But one thing that we learned from the first COVID surge was that the documentation, when you're having to do donning and doffing and your resources are stretched a little thinner due to team members out with illness, in addition just to extreme volumes, is that we needed to focus on reducing nursing documentation. And our CNOs actually petitioned that we modify the standard documentation to reduce documentation for our nurses during this time frame. So eliminating care plans for our nurses on the acute care side, also doing an emergency documentation field that reduces the elements that you have to document. So I think it speaks to an organization that is very focused on the frontline nurse and how can we ensure that their time is spent, most importantly, with the patient, connecting with them and keeping them safe.
Okay, thank you. Yeah, that's really impressive. So I appreciate that. Thank you both.
Thanks for that question. Very good. We take culture very seriously, so it is paramount for us, and we want to make sure that this is an employer of choice, not just from a hospital setting, but from an employer brand. We want to make sure that that we take culture and anything HR related, such as that, quite seriously. I want to send a link in the group chat. It's inova.org/careers/events. If you liked what you learned during this setting, we have more events like this where you can register just like how you did before. So I'm going to put that in there. We have an event coming up tomorrow. Tomorrow we have an event, a hiring event. If you're not ready, if you're still in school, that's fine. But if you know others who are looking to apply, they can register at that event. My colleague Sean and I will be conducting screenings and immediately sending off candidates to leaders, such as whom we have on the call, to conduct interviews. And you can get an offer very quickly. It's a very nice process we have here. But don't be concerned if they get your job, they didn't take yours. There's still plenty of other opportunities here at Fair Oaks and within Inova. So please take advantage of this. I'm going to send it in right now, but I'm going to turn it back to the Q&A forum. Please, any questions, dive in.
I would add that I think we're taking spring grads at the walk-in Wednesdays for interviews. So if you are graduating this spring, even if you haven't graduated yet, we still would love to talk to you for one of our spring positions. So don't be shy.
Yes, please.
About what you just talked about tomorrow's hiring event, then would that include for spring graduates coming in for summer positions, or is this for spring positions starting?
So we definitely would be willing to talk to you about if you're graduating in May and you're looking for a summer position. Yeah.
Yes, certainly. Certainly.
Okay, thank you.
Hope to see you tomorrow, Ashley.
I definitely look forward to it as well.
This event will be virtual. We do it through Indeed. It's a very good forum. I really like using it. We did have it in face, but due to COVID, we had to transition back to virtual. So we're looking forward to seeing you virtually.
And I have a question regarding that. Sorry, hi, my name is Lucy. So where do we get the link to join tomorrow's interview?
I can put the direct link in the chat momentarily for you.
Okay, thank you. And again,
Sure.
thanks for everyone who held this like very informational session. I just have a question regarding, so I'm very interested in your ICU. I'm actually looking for a position as a new grad as soon as possible. So what is the like the time, like how would I say, like the time period for a new grad, and also like the time for orientation for neuro ICU? Sorry, my voice is like a little coarse.
Oh, no worries. Thanks for joining, Lucy. So we actually just hired 3 new graduate nurses that are starting now for our December cohort. So we are going to hire 2 more, and they would start in July. So if that's too long of a wait for July, if you've already passed your NCLEX, then we can connect you with the recruiter and get you to, there's plenty of ICUs throughout the organization, or our progressive care unit would probably be a good starting place for you. And then the orientation, so let's say you started in July, you would do a 16-week on-unit orientation. You would also do the self-paced echo modules, essential of critical care modules that you would get. And then you would also join a nursing residency program. So for everybody on the call, no matter what specialty you're in, what unit you're in, all of our new graduate nurses join a nurse residency program. And this is really to strengthen your professional nursing practice. And you're all together as one large cohort. You do work on an evidence-based practice project that you'll pair up with teams and then implement. And it's just a great learning opportunity to do simulation learning in there as well. Deterioration, you get to interface with a lot of our clinical leaders and clinical experts.
Okay, thank you so much. And I think July is a little late for me because yeah, it's January right now.
You have you passed already, Lucy, your NCLEX? Congratulations. Let's get you, are you interested in our progressive care unit? Because we have opportunities right now for that.
I mean, I am interested, but thank you so much. I am interested because I did my preceptorship in Euro ICU. That's why I wanted to like grow more into it. So yeah, but of course, like every like opportunity is a new learning experience. So,
hey, Lucy, let's connect offline. I'd love to talk with you. I'll put my email in the chat.
Okay, thanks.
Hello. So I have a question. My name is Ashton Noel. I'm actually an international new grad. I am from Jamaica and I just graduated from the University of the West Indies, and I did a bachelor's degree in nursing. My question is there a program for new international new grads? Because I did not hear anything about that, so I just want to make sure.
Hi, Ashley. Yes, thank you for your question. We indeed have a program for people such in your situation. So I did have my email address thrown in the group chat. I can toss it in there again, and please contact me directly and we'll give you more information, okay?
Okay, thank you.
You're welcome. Speaking of tossing things in the chat, we were able to put in the sign up for our hiring event tomorrow through Indeed. So if you feel like you're ready, awesome. Just register here and we'll be chatting with you tomorrow. And
Hi,
anyone,
my name is,
yeah, go ahead,
sorry.
please.
I was gonna say, hi, my name is Michelle. Sorry, I joined a little late, so I didn't hear if there were any externship programs. I graduate in the summer, so I'm just on here a little bit early, but I was wondering if there's any kind of programs like that.
So you're graduating in May?
I'm graduating in July.
July 2022?
Yes.
So typically the nurse externship programs are usually people that are in their last semester of nursing or their last year of nursing program. But we would definitely be interested in interviewing you now
Okay.
for the July timeframe for sure.
Okay. Thank you.
Is there any specific unit you're interested in?
Labor and delivery.
Okay, so Joanna hopefully will be able to connect with you related to L&D.
Okay. Thank you.
So I'm gonna put my email in the chat.
Perfect. Thank you so much.
Thank you all. What else do we have? We still have plenty of time, so please don't be shy.
Hi, my name is Samaya. I'd like to thank everyone for their insight. It was really good to hear what everyone had to say. I was just wondering if there was like a timeline to when we would start. I graduate in May of 2022. So if I can just, like the expected date to have your NCLEX in by and expected start date and things like that.
So I could speak for acute care services. What we're seeing is it's nothing that we've actually seen before. We are actually seeing May graduates interviewing and applying now to positions. So from an acute care perspective, ED, ICU, medical, progressive care, we're trying to be proactive, and we are already posting those new graduate positions now. So our May new graduates that would start, I believe it's July 27th. Nikki, fact check me on that. Those we're already interviewing. Our progressive care, I think, has already hired 2 people into that cohort. Some of our units do have a March cohort still available. Our medical unit has some people available for the March cohort. And then we typically hire August grads, and they usually start in October. So I would say if you're interested and you're going to be sitting for your boards this year in 2022, and you like one of the units that you hear, connect with the leaders now and start applying. It's not too early in 2022, honestly.
I have applied already. I just was wondering, so the start date would be in July?
Yep, the start date would be in July. And the reason we selected July is because historically, we see the NCLEX testing times that our new graduates get, and we give them enough time to finish their NCLEX testing. And that's typically when the large cohort is able to start. And then the value is all those people that start in the July 27 cohort, they get a start residency program, that nurse residency program that I spoke to together.
Mm-hmm. All right, thank you so much.
You're welcome. And what unit did you apply to?
I applied to the residency in general, but I specified in the medical surgical progressive care, and it was those 2 specifically.
Okay, great. So that's going to be Elizabeth, Christina, and Nikki. So out of the 3 of them, one of them will be connected with you.
Thank you. It was great hearing everyone speak.
Thank you.
Thank you so much.
And for anyone else who has applied to a role and still waiting to hear back, you should have received a confirmation email. Feel free to forward that and connect with Carol and Erica with their email seen in front of you, and they'll be able to assist you.
Would I still be able to go tomorrow to the interviewing process, or should I wait to hear back?
You're more than welcome to join. I'm not going to turn you away. But I would, if you already applied and you're gung-ho on that particular position, just connect with Carol and we can give you more information regarding that. But either way, you're welcome to come.
Thank you so much.
I had a question about tomorrow as well. If you say, is tomorrow a more expedient way to get into the process of, sorting the folk out who you want, or is it just, very similar like today? Just like, information session and getting info about the different units of that sort, or is it like, I should bring my, my list of questions I need to ask the different units, as well as different things I need to know about a job I'm going to take, as well as I want to get as much information to them as they need as well. So
yeah, that's another very good question. So what we have here at Fair Oaks, we have what's called Walk-in Wednesday. So every Wednesday from 1 p.m. to 4 p.m., we connect with people like you who are interested in opportunities here at Fair Oaks. My colleague Sean and I, we do initial screenings, sort of feel you out, understand what you're interested in, what unit you want to support. Do you have minimum requirements that we're looking for? And once Sean and I are able to identify a good spot for you, we will then reach out to the leader and set up a first round interview for you same day. If you would prefer a different day, we can always coordinate, but that's what we're doing here here at Fair Oaks.
Okay, as well as if that process gets started, do I still need to slide in what's it called, not a resume, but a application, just for you guys to have my information on file and things like that?
Not yet. You don't need to submit an application as a prerequisite to join us on Walk-in Wednesday, but you will need to do that as soon as you can afterwards.
Okay, thank you.
And all that information, our recruiters are happy to help you send the specific link to the specific requisition that you're interested in. Good question. I see here we have 15 minutes left, so still plenty of time for any questions you have.
I had another
Hi.
question, actually. Oh, I'll let you go first.
Okay, sorry. Hi, I'm Hannah. I just want to say thank you to everyone so much for speaking today. I just had a quick question for clarification. So based what I heard about the emergency department, you said that you were looking for, you have 3 open spots. And I was just wondering if that position would also start in July along with the other ones.
So no, we're looking to hire, I guess it would be December grads for February coming up.
Okay, awesome.
A little bit sooner.
Perfect. Thank you so much.
Mm-hmm.
There was a question thrown in the chat. I will take my NCLEX on 216. Could I catch February? Fellowship if I passed. Can anyone answer that one?
I was going to say it probably depends on what unit you're looking for.
That's what I was gonna say too. What unit?
Okay. I think it was Ashley. Did you have a question?
Yes. I had a question. I saw the times for tomorrow's event, and I'm not sure I can make it with class. So I kind of had a question about if I've already submitted an application for the residency program, and I know that you can preference units for that one. But if I'm not like completely dedicated, or like it's not like I have to completely get into those, is there still like options for being able to reach out to other units as well, besides the ones I've just preferenced on that application?
Yeah, it's not too late. If you change your mind during the application process and you haven't committed or started, we can always work with you and work with our leaders to find a better fit for you. We are very accommodating. Our goal is to make sure that we find a position that's tailored to not just what you like, but also what you're good at. But you don't really know what you're good at until you start, and you may pick up skills and competencies throughout the way, which you can then change into different positions. So we're very accommodating to what would work best for you.
I have a question. Thank you so much for the information session. So I don't know if I heard this correctly. This is kind of just like to clarify. If we've already applied, then we shouldn't go tomorrow, or we should?
Good question. And just to be clear, we will take anyone on Walk-in Wednesday. If you have already applied, please still attend. If you can't attend tomorrow, we do this every Wednesday. So every Wednesday, inova.org/careers/events, you'll see the event and you can apply and join us. You'll meet Sean or I virtually, and we can go through your standing application or your application that you're thinking about putting in. Please join us on Wednesday.
Okay, I plan on it. Thank you.
Awesome.
Hello, my name is Jessica. I am a 4th semester nursing student with an anticipated graduation date in May. I had a question in regards to the application. I did complete it, but then I got an email saying that they weren't hiring yet for May grads. So I was wondering if there's a link for like the specific application, just in case I clicked on the wrong one.
That would be a great question for Carol or Erica. The email address that you see right there, please reach out to them and they can help follow up with you on that.
Jessica, what unit are you interested in?
I am interested in OB, the NICU, and then I was also interested in the PACU.
Okay.
Jessica,
Thanks,
I can tell
Jessica.
you right now, we currently do not have a fellowship for PACU. At Fair Oaks, we're starting a new fellowship program. So we can get you more information once that does come out, but we currently do not have a fellowship for new grads in our PACU, but again, get more information out to you.
Okay, thank you.
Yes.
Thanks so much. All right.
I have a question for Nikki. What is the typical patient to nurse ratio on the progressive care unit typically? I don't know if she's still on.
Nikki may have stepped away, but I can answer that.
Okay, thanks.
It's going to be typically between 4 to 5 patients,
Okay.
depending on the acuity and what's going on the unit.
Thank you.
You're welcome.
One thing I did want to just highlight and differentiate that a lot of organizations don't have that Inova does, specifically Fair Oaks, is when you look at the support that the unit's going to provide you, you need to look at if the charge nurse is in a patient assignment. And we are very, very fortunate and blessed with a lot of advocation and understanding from our financial colleagues that it's essential to have charge nurses out of staffing. And the value to that is, as a new graduate nurse, you're going to have somebody that, you know what, this order just doesn't look right, or this patient looks like they're not doing well, and they're going to not have a patient assignment. So they're going to be able to come to the bedside and support you with that. So that's something that I would encourage you to look at. Also, some of our units here have resource nurses that are built into their matrix that are not assigned to a patient assignment. So I'd encourage you to ask those kind of questions, encourage you to ask ClinTech ratio questions. Our typical ClinTechs or any ratio to patient is 9 to 12 on the acute care side. And then I would also encourage you to evaluate if there's any resources, like Fair Oaks Hospital has a SWAT nurse typically throughout the day and nights that is a free floating nurse that can also help with patients that are deteriorating, or if a team member needs to go home sick. That'll, some of the other organizations out there, you'll find that they don't have that support.
Katie, on the topic of support, I'm just thinking about the support roles in the hospital. I'm just wondering about respiratory therapists. Are those on call? Are they available throughout the hospital? Are they just kind of near the ICU? Or if somebody needs a nebulizer treatment, like, do we have respiratory therapy doing those things throughout the day? I just was wondering how that works.
Hi, I was looking for Fernando because they report to him, but I think he had to step away. So we do have 24/7 respiratory therapists that support the hospital. Current state, we do not, our nurses don't do respiratory treatments. We're very fortunate in that regard. So typically there's always, even no matter what time of day is, there's 2 in-house to support, but they do your neb treatments, your inhalers. They do support the ICU, of course, the ED, the NICU areas, the women's area.
Great. And would you happen to know if there are wound care nurses at Inova Fair Oaks as well?
Awesome question. Yes, we're very blessed with 2 wound ostomy nurses. And here is another example of where our administrative council has really invested in frontline support to the patient. We recently increased their hours, so we have them here more frequently. So you can consult a wound ostomy nurse, and they can see your patients if there's any skin issues. They also help with wound ostomy, wound vac changes, and can educate our nurses on that as well.
Katie, I'm going to add to your comment as well. The wound ostomy nurses work across the whole hospital. They help us in the peri-op areas as well, which is kind of unique to Fair Oaks. So they're great partners to have. And we do really appreciate their support.
I had a question right before we go. It's just about just career progression within Inova as well as the Fair Oaks Hospital in particular. Like, so we started in the residency program, then we move. Is there a linear path? I'm a little bit older. I'm doing this as a second degree, and I'm like, I want a career. I don't want a job. So that's what I'm like, are there like steps to where we are aiming for as we progress within the organization, or is it more once someone sees you are ready for the next responsibility level, you're given that opportunity? If that's not too deep for this forum right now.
That's a great
Yeah,
question.
that's a great question. And I think a lot of us will take that. Almost all the clinical directors and senior directors on this call started as a new grad, or even I personally started as a clin tech in the organization, and I'm now a senior director. So there's multiple growth opportunities across the organization, and you can find them or they will find you. It works kind of both ways. But there's definitely, and not only at Fair Oaks, but like Debbie said, we like to work across our organization. So if there's a good fit somewhere else, we're happy to help you anywhere within the Inova nation, find somewhere that's a good fit. But yeah, I think almost all of the senior directors and clinical directors started at an entry-level position and have worked their way up and found a career. Inova is not just a job, it is a career and a home.
I'll add one thing to that. So because we are a magnet hospital, succession planning and that career pathway is so important. So there is a career coaching program that the organization supports. And what you do with that is you apply to participate in this. After your year of residency, you'll be encouraged to apply for that career coaching program. And then you get paired with a mentor. And it could be whatever your interest is in. If you want to be a clin spec, then you get paired with the clin spec. If you want to be the leadership pathway, we would look at unit supervisors, clinical directors, senior directors. Chris, our ED nurse, actually got a new graduate, got paired with Debbie Fulbrook, our CNO, and has such an amazing experience with her. So there's structure in place. And then you heard Kimberly earlier talk through, we really want to focus on your professional development and give you feedback real time and help you achieve those goals. So we strive to do quarterly check-ins with our team members, kind of seeing how you're progressing. What does your next career move look like? Do you want to go advance to an RN3? Do you want to join a committee? So a lot of structure behind that at Inova.
And Pierre, you're not alone in this second career. Jennifer, who's on our call, who's our director over surgical, she was in banking before she came to nursing. So I'd encourage you to connect with her.
Yeah, definitely.
Good question. Thanks for that.
One of the things within the surgical unit is it's really up to you. It's where does your interest lie, and kind of where do you see yourself going, and then having those conversations with your director and your supervisors, and then then just kind of keeping an eye out and just helping you grow within the organization. So there's a lot of growth opportunity, and that's one of the nice things in the surgical unit. A lot of our nurses, you get that foundation, and then they go to all different areas throughout Inova. So that's the great thing about the Inova system, is there's 5 hospitals that you can work within too. So if it's not here at Fair Oaks, we have plenty of places that you could look to continue to grow.
Thank you. I appreciate that from all of you.
We still have time for a few questions. We have a couple minutes left. Anyone else?
Hi, thank you all so much for doing this session. I'm very interested in doing labor and delivery as a new grad, and I was wondering how many new grad positions there will be for the summer cohort, and if the start date is also July 27th for that.
So for our summer, we're looking at 2 to 4 new grad positions. I know that we have, I believe the position is posted now. So I have started receiving applications already. And yeah, that one is also starts the end of July. And the fellowship starts about 2 weeks after that. But it is a July start date for that one also. But I believe that position should be posted now.
Okay, thank you so much.
You're welcome.
If anyone is interested in the OR, we have a fellowship that will be starting as well in July. So if anybody has any interest, they can email me. I put my email in the chat, and I can forward it to Stephanie and Chad, the OR director and senior director. So thank you. If anybody wants to scrub and circulate 1 patient at a time, the OR is a great place to work.
Thanks, Brenda.
I have a question about applying between the fellowship listings and then the overall like nurse residency listing. Do you guys recommend one or the other or both?
Are you talking, is it a general position or is it for the OR?
Just in general, like on that careers page, there's a nurse residency posting like from Inova, and then there's the specific like floor fellowship postings, and just wondering if you guys recommended one over the other.
So
Sure.
oh, go ahead, John.
No, I was just going to say it's a very good question. Generally speaking, everyone has their own specific situation, so it depends. But Walk-in Wednesday is a great forum to get to know us, for us to meet you, to see what's best for you, whether that's right away, a couple months from now, whenever. We're happy to meet you and answer any questions in such a forum.
And I will say the fellow, there's different language and it can be confusing to navigate as a new grad. So I did want to just give you a little clarification. So a residency or a grad fellow is the same, but we will have positions posted that you'll see that just say fellow. Those are a little bit different. Like for example, if you applied for a medical fellow unit position, not a grad fellow, that would be someone who has experience in like a long-term care setting or something like that. So if it says new grad fellow, that's the same as our residency, but if it says just fellow, then that's kind of looking for different experience level. So you would look for the grad fellow or residency if you do not have experience as a nurse.
So are the,
oh, I'm sorry, go ahead.
no, so I was just, for clarification, the grad fellowship and the grad residency would be the same thing, it'd be the same process, even though there's like two separate listings for it?
Yes, that is the case. There is a position posted that is what we call something that's a general posting that's for all new grad residency positions at Inova. And so that's, since not all of our positions are open for 2022, we are having new graduates apply to that as well. And that puts you in our system. That's where we're asking you the questions about your unit preferences and things like that, because then you will be ready to go and contacted by recruiters for a variety of positions. But then you'll also see some of the positions that Fair Oaks has posted that are for their hospital specifically. So you can really apply to both. If you're interested in both, be sure to apply to that more general nurse residency. That will definitely get you in your system. You'll hear about events like this throughout our system. Does that answer your question?
Yes, thank you very much.
Good question. Carol, thank you for that. Alrighty, everyone. So we are out of time. Thank you all very much for joining our event, our virtual tea, just for you. Another shout out to our leaders. I know you're very busy, so we appreciate your time and attendance and participation. The information you were able to share, I'm sure was very well received, very helpful. Please monitor our careers webpage. All information is in the chat. We are looking forward to seeing you, and best of luck. Any questions, please let us know. We're here to help you land your career. Thank you very much. Take care, everyone. Bye-bye.